Assalamualaikum everyone. Okay, now we come to our second lecture. I hope everyone has studied and watched all the videos from the first lecture, because that knowledge will be carried out in this lecture as well and throughout our lectures for upper limb. So the second lecture is about anatomy of the pectoral and axillary region. I've divided this lecture into two sections, which are pectoral region and axillary region. And basically, we will learn about the origin, insertion, action, and innervation of pectoral muscle, rotator cuff muscle, and superficial back muscle, which include trapezius, latissimus dorsi, and so on and so forth. Okay. And for axillary region, basically more towards the structures and borders of cervico-axillary canal. Yeah. Okay. Before we move on to the main topic, let me just brief you. Maybe some of you already know this, but just to be sure, we have axial skeleton, which consists of the central bone, your skull, thoracic, spine. These are your axial skeleton, and your appendicular skeleton, which are your upper limb, lower limb, pectoral girder, and pelvic girder. Okay. And okay, before we move into the main topic, I just want you to know that for your upper limb to be, to be connected to your axial skeleton, these are the muscle that involved in this connection, connecting your upper limb to your axial skeleton, which are the one that connect your pectoral girdle first. Pectoral girdle consists of clavicle and scapula. Okay, so the ligament that connect these two bones, your scapula and clavicle, are the one you remember, your acromion, the tip. Okay, from the first lecture, acromioclavicular ligament is the ligament that joining your scapula, acromion process, to your scapula. And the other one is coracoid process of scapula. Okay, connecting to your clavicle by coracoclavicular ligament. Okay, so scapula, your pectoral girdle connected, scapula and clavicle connected by these two ligaments, which are acromioclavicular ligament and coracoclavicular ligament. Okay, and your clavicle connected to your first rib cage is your axial skeleton. So your clavicle connected to your first rib by this purple ligament, which is costoclavicular ligament. Okay, and your clavicle also connected to your sternum, also your axial skeleton, by sternoclavicular ligament. Okay, so these are the four ligaments that connect your pectoral girdle to your axial skeleton. Okay. Is it enough for these four ligaments to hold your upper limb, the exertion from your movement and everything? So basically, the muscles around your pectoral girdle, around your shoulder joint, there are so many muscles here, and these muscles are the one that hold your upper limb, that holds your upper limb to your body. Okay, this is basically just what I've mentioned before this. Okay, so move on to the first section, which is the pectoral region. Okay, don't be intimidated with all the words here. What I want you to know is that I've mentioned before this, pectoral girdle consists of scapula and clavicle. Okay, so these are the muscle that attach to your scapula and clavicle. Okay, by the way, okay, you know there's origin and insertion for each muscle, and you know the difference between that. Okay, the origin, for example, okay, your coracoid process, your coracobrachialis muscle, okay, attached to your coracoid process of scapula. This is the origin, and inserted to your humerus, okay, midshaft of humerus. So the origin is the fixed point of the muscle, and the insertion part is the one that, okay, when the muscle contract, it moves the distal part, no, the insert where the muscle inserted, like your flexor muscle from medial epicondyle origin. The origin is from medial epicondyle of humerus and inserted to, let's say, your radius. Okay, so the fixed point is here, the medial epicondyle, the origin, and inserted to your radius, resulting in flexion of your forearm. Okay, instead of like this, okay, it become like this, because this is the fixed point. Humerus, medial epicondyle of humerus is the fixed point. This is the insertion part. When the muscle contract, it flex the elbow. Okay, so where were we? Okay, of all this muscle, okay, omohyoid and sternocleidomastoid will not be covered in my lecture because it is more towards head and neck region. And tricep, brachii, I don't know how to pronounce it. Okay, tricep, coracobrachialis, and bicep brachii. I will cover this muscle in other lecture. Okay, so for this lecture, we will be focusing on the one that I have bolded here, which are the purple bold muscle, pectoral muscle. Of course, pectoral muscle consists of pectoralis major, pectoralis minor, serratus anterior, and subclavius. And for rotator cuff muscle, the muscle that cuffing your shoulder joint, supraspinatus, infraspinatus, subscapularis, and teres minor. Okay. Okay, this also the slide I've mentioned before this in our first lecture. Okay, just to show you that this is posterior view, anterior view, supraspinatus, infraspinatus from posterior, and also teres minor from posterior, and subscapularis, okay, from posterior and anterior. These are the rotator cuff muscle. That's why it's, cuffing, covering your shoulder joint. Okay, from anterior and posterior. Okay, now we will talk about, okay, pectoral muscle. The first one is, okay, pectoralis major. As you can see here from the picture, it has two origin. The first one is clavicular head, the green one, and the second one is the sternal head. It originates from the sternal edge, okay, from rib 1 to rib 6. The clavicular head originates from the medial half of clavicle, and this muscle, okay, inserted to lateral lip of bicipital groove. Okay, if you remember this slide from our first lecture, this is the intertubercular sulcus, okay, which also known as bicipital groove. Okay, this is the medial lip and this is the lateral lip. So deltoid muscle, pectoralis major muscle inserted to the lateral lip of bicipital groove. Okay, by knowing this, when you know that the insertion, your pectoralis major inserted to the lateral lip of bicipital groove, you immediately can imagine when the muscle contract, it will medially rotate, okay? And also, when your hand is in abduction, your pectoralis major assist function in adducting, okay? Adducting your upper limb and internally or medially rotate. This is like, for example, in arm wrestling athlete, okay? He will use his pectoral muscle, okay, during the sport, okay, for internally rotate the upper limb, yeah. And what else, yeah? Okay, and clavicular head also assists in flexing, because you see from the picture here, okay, the clavicular head is from above and inserted to your lateral lip of bicipital groove, so it have some assistance to your assist in your flexion of your upper limb, yeah. Okay, and because it is a major muscle, a big muscle, it is innervated by two nerves, which are medial and lateral pectoral nerve, and supplied by thoracoacromial artery. Thoracoacromial artery, we will, throughout this lecture, we will see a lot of thoracoacromial artery. I will mention a lot of this artery because this is one of the branch, one of axillary artery branch. Okay. Okay, the next one is pectoralis minor. Pectoralis minor, okay. You have major and you have minor. You cut the major muscle here and you can see the pectoralis minor. It is also used as an accessory muscle of respiration. Okay. You can see here how it assists in respiration, okay. You learn this in physiology. It originates from the third, fourth, and fifth ribs and inserted to coracoid process of scapula. Okay, if you can see, okay, I have mentioned before this, coracoid process of scapula also is a point of origin for coracobrachialis muscle. Okay, from here to here. Okay. What else? Okay. Okay. Pectoralis minor, it helps to stabilize scapula by keeping it in a position with the chest wall. If you can see in the video before this, it keeps the scapula near, adhere to your ribs, and it is innervated by medial pectoral nerve. It is a small muscle as compared to pectoralis major, so it only needs one nerve, which is medial pectoral nerve, and also supplied by thoracoacromial and superior and lateral thoracic artery, which are branches from axillary artery as well.